record. Everyone. Oh, great. Recording's in progress. Nice to meet you and see you again after hopefully what was a good summer. My name is Jo Gordon. I am an NP up in Whistler, BC, and I live in Squamish. And I'm also the regional lead for the Vancouver Coastal Health Region with Calvin and Annalise. So super happy to be here. I'm going to be your host for the next few months. We have a very busy agenda today, but I firstly just wanted to do a land acknowledgement. So super happy to be coming to you from the shared territory of the Lillooet and Squamish Nation here in Whistler. And then we also need to quickly approve any additions to the agenda and also review of minutes from last time and the agenda for this time. So just I need someone to first that. I think Jenny put her hand up there. Great. Anyone willing to second that motion? Okay, Marjan, thanks so much. All right. Great. And I'm just going to keep letting everyone in. Okay, perfect. Awesome. So yeah, I'm just going to get right to it because what we're going to do is have a quick update from our program. Oh, and just remember to put yourself on mute. Okay, great. Yeah, a quick update from our program. And then we have the Ministry of Health coming at 4:20. That will be Fiona Hutchinson and her team to talk about the provincial attachment system. Yeah, so quickly to our news and your news as well. Firstly, from our team, we have some new members, which is great. We have a full roster of RLs. So Annalise Hassler from the Sunshine Coast joining the Vancouver Coastal Health Team. Colleen Pattenode up in Williams Lake is taking over the Northern lead. Sarah Jeshope from Victoria is going to be working with the island. And then we have Julia back in the Interior Health. So super happy to have all those people here with us today. In terms of our program itself, a few updates. One is on reimbursement. So get your pens out because there's quite a lot that changed over the summer. The first is for those of you who read the new contract. Sorry, I'm going fast and I will slow down and feel free to ask questions. But for those of you who read the new contract, you can see that we are getting our licensing fees reimbursed. So your BC, CNM, NP licensing fees. So if you haven't already done that through a health authority or some other means, they will now refund you. So the link is on the NP PSP website. Please go in and submit for your reimbursement for 2023. Please note when you go in there, there's like a 6-month limit, but there is an exception to this year because we didn't find about it till after 6 months, 6 months after we had all registered. So ignore that for now, but for next year, we need to submit it within 6 months after submitting that registration. A couple other things on the reimbursement front. Up to date will now be reimbursed. The details to be announced in the next newsletter, but this will be in addition to your CPD. We can all now apply for an up-to-date reimbursement specifically. So more details to come on that. And we will happy to answer questions on that. And the final reimbursement is actually not from our program, but from the secondary institutions and having an NP student. So a new funding announcement to acknowledge all the NP preceptors. We don't have the final details and that policy will come out from the MOH and we'll share it as soon as we have it. But essentially looking at financial remuneration starting September 2023 for everyone who has a student. There's different amounts for different hours and you'll be paid directly from the institution. So not through our program, but a nice boost for anyone who is working hard with students. And we want to acknowledge that it's wonderful to have one. They're always looking for students and hopefully that will be a good financial incentive as they ramp up all the enrollments and we're asked to do more. So that's great news. From the PSP program specifically, I wanted to update everyone on a few things. The NP PSP website, you'll notice, especially if you're in a new contract or you're newly starting in a contract, there's a new tab on the right. I was going to share screens, but I don't really think we have time, but please check it out. There's a little button called your PCN journey. Thank you to Calvin and Kaylee who worked on this hard from our team, but there is just a nice like linear organization of our materials right now. Tamara is putting everything in the link. There is also a new information for locuming, a new info sheet on locuming. So this is an info sheet for you when you're getting a locum to think the things you need to think about when you're working on your agreement, but also something you can share with anyone who wants to locum for you. It is like a excellent 4-page dense document and hopefully we get a lot of questions. We do not and are not able to provide a template for a locum agreement, but hopefully this will give you guys some guidance when you're working on getting someone to come and work in your practice so you can, have similar expectations before they start. Yeah, and please throw any, Danny, Thank you for asking a question. Can you put it in the chat, Danny? Because we only have about 3 minutes before Fiona comes. And then if we don't get, I'm going to ask you after I'm done my update. But if we don't have time, I can make sure to get back to you. Does that work, Danny? Yeah, I'm going to assume yeah, because your hand's down. Okay, cool. Thanks, Danny. Okay, a couple other things from our program. What time is it? 4:21. Yeah, we have 4 minutes. We're good. Clinical corners are back every second Friday. September 22nd is office cardiology. Thank you for all of those who attended the heart failure one. It was so great. From the QI side of things, we're happy to announce that the Health Data Coalition, we've had some great meetings with them, and now participation with them counts towards QI education. We have them coming to the October COP. They're going to be here chatting about it, so no need to rush into that, but an exciting development. From the mobile skills team, please today, if you're interested in either becoming a subject matter expert or having participating in the mobile skills program, we have an info session after this meeting today, 5:15 to 5:45, or get in touch with a regional lead if that doesn't work for you. And then I'm getting to the end of it, but last but not least, the St. Paul's conference is coming up in November, the family practice update. Our team will be there. Many NPs choose to attend. The registration is now open. There is an NNPBC NP networking event in Vancouver around those dates. So definitely, if you're planning to travel to Vancouver for the conference, please check out that event. And then last but not least, an update from Sarah Just Hope, our new RL, on a new after hours care program on the island. And then I'll try to get to some questions.
Okay. Hi, everyone. My name is Sarah. Nice to see you. Nice to meet people I haven't met before in this role. So the after hours pilot, you all probably got an email about it a few months ago. It is readily moving along and launching September 19th. This is a project put together by FPSC and HealthLink BC. It will initially be staffed by family physicians. The goal is to have nurse practitioners as staff as well for now. It is in 6 pilot regions, so focus in these areas. If you want to participate, meaning you can register for the service and the FP team will cover your patients after hours. No commitment from you otherwise at that point. So you eventually could work the service, but for now you can utilize it, which is really awesome. So Langley, South Okanagan, Similkameen, South Island, Thompson Region, and Victoria Division of Practice are all the pilot regions right now. The pilot will go for 6 months, and if it goes well, it will become a provincial offering. So I'm going to post the links in the chat. There's a one-pager that gives the history of the project and what the goal is, and then a little bit more of a facts section, and then there's a section on how to register for the service. Please don't hesitate to contact me if you have any more questions about it, or anyone else in the PSP program. And yeah, if there's questions later, I'm happy to address them. Short and sweet.
Yeah, perfect. We're on time, Sarah. I love it. Thank you. Danny, I got your question. So Danny's question, just so everyone knows, basically, how do we update on how we access the panel management funding? Fiona and her team are here to talk about the PAS. Danny, I can tell you that it will be administered through contracts and it will roll out over the year as PAS rolls out. So we don't have any final word on how it's going to go, but updates are going to be here, and definitely we'll keep those questions top of mind because I think that is top of mind for all the NPs. So thanks for asking that. Without further ado, I am going to introduce Fiona Hutchison. She also has a team here. Fiona, I don't know if you're going to, I'm just going to introduce you and then maybe you can do the team. But Fiona is an OT. Yeah, does that sound good? She's been an NP for many years and very foundational in our profession in BC. So happy to have her here today. She currently serves as clinical director of the nurse practitioners and midwives of the Nursing Policy Secretariat at the Ministry of Health. Big title. She is here today to discuss the provincial attachment system. So we're going to be talking about PAS today. We are not going to be talking about contracts. That is a separate FAQ session. For those of you who note, there is that incentive, which is primarily based on uploading and managing your panel on the new PAS. This has been a huge project in BC and is pretty exciting, huge benefits in terms of data and understanding the primary care landscape in BC, as well as for patients wanting to sign up and finding someone. So we're excited to be part of it and happy to have you guys here today. Please, again, for any questions, please put them in the chat, and then we're going to group them together at the end.
Thanks. Thanks, Joe.
No worries.
I'm having a weird tech day and I can't see myself. Can you guys see me? No.
I can see
No,
some.
weird. My video is not on, like my stop video is not there. But so like I'll put my video off because at least then you can see my name.
Yeah,
And it's not
perfect.
just a blank screen. I don't know why my video is not working. Super weird. It worked 2 minutes ago when I popped off another meeting. But apologies for not trying to hide from you. I can see some of you, and I can see in the participants list there's 71 people on here, so that's really awesome. And I'm hoping Tamara is online, or Joe, one of the two of you will be able to put our slides up, because you don't need to look at me. You just need to look at the slides anyway. Do you guys have that, Joe?
Yeah, we have the slide deck. Yeah, Tamara was just putting it on.
If you could
Yeah.
just,
It'll be me. Yeah. If you're ready, Fiona, do you want to introduce your team first, or you want me to just yeah.
No, put the
bring
slide
it right
deck
up?
up, and it'll take care of everything, I hope. Thanks very much. Great. So we'll just get it into the full mode there, and that'll be sweet. And I'm hoping you'll just be able to manage flipping to the next screen. So yeah, just to start off, I want to do a bit of a land acknowledgement. The ministry, I think everyone knows, is in Victoria, and that is on the ancestral and really current homelands of the Lekwungen people, which are known in these times as the Esquimalt and Songhees First Nations. And I am coming to you personally from my home in Sooke, which is also known as Sauk, and it is with a lot of gratitude that I get to live in a very beautiful place. And I personally am learning every day about cultural humility and the Indigenous people of this region, and seeking to be an ally. And I'm sure you also had some sort of acknowledgement earlier, and encourage all of us to continually think about Indigenous peoples who were here first, and how our work ties with them. Next slide. I'm going to introduce, and there's the full mother title. Oh, that's yeah, it's a long title, and it's not even got everything in it that's on my thing. But anyway, bottom line is I'm an NP, and I work in the Ministry of Health, and that's a great thing, I think, for MPs to have actual MPs working in the ministry. And I am sure a lot of you know I work along with Zach Natiushan, who's our Executive Director for the Nursing Policy Secretariat. And with me today, I have Heidi Bergstrom, who is actually, I think that's not quite the right title for her, but I'll let Heidi introduce herself with her proper title. And also I'm with Tara Macklin-Smith, who's with Provincial Health Services Authority. And PHSA and the ministry have been working together very closely on the work related to the PAS. So good question, Danny, that I saw there. What is PAS? It stands for Provincial Attachment System, and that's what our chat today is all about. So with that said, we'll move to the next slide, and I'm going to hand it over to Heidi to walk us through. And I think, yeah, as Joe said, we'll have time for questions at the end. So we'll keep track of those and go through them. We'll try to get through the slide deck as fast as we can, so there's lots of time for questions.
Yeah. Okay. Thanks, Fiona. So thank you, everyone. I'm Heidi Bergstrom. I'm the OCM lead for this project with the
PHSA. And I'm working with Stephen and Tara and Miles, our OCM team together, are providing all the training and support and communication and engagement, various different activities like that. So thanks again for having us today. We're really excited. This is a milestone for us. Yay. Today, I'm going to take you through the provincial attachment system overview, panel upload process at a high level, some of the initial activities that we're doing, the onboarding timeline, the training modalities, and the Q&A. And for all of the training material, Tara is going to take us through that. And if I just wanted to let you know, I have been struggling with a really bad coughing chest cold thing today. And if I start losing my voice, then the team's going to take over for me. Thanks. Okay, we'll go to the next slide. Right. So this is the provincial attachment system overview slide. I'm not going to detail everything in that fun map on the right-hand side of the screen over here on how the process works, but just at a high level, the goal is really to improve the attachment process between people wanting access to primary care and primary care providers. The benefits to this new system is to help new to practice and under capacity providers increase their panel by attaching those local patients in need of services, reducing the administrative burden of managing patient wait lists. Some folks have wait lists in various different places, and there's a big effort on now to bring them together and consolidate. Redirecting those folks who are looking for a doctor or a nurse practitioner, those calls that are coming in from clinics, and redirecting them to HealthLink BC. And improving communication pathways between clinics and patients. So that's also a really key thing is, how do clinics and patients actually get connected? Sometimes patients walk in and they're like, I need some help, but the clinic is not able to direct them to anybody. They've got a long wait list. This service is going to help ensure that people get connected in their communities when they need it. And it's going to give providers a chance to put their hands up and say, yes, I do have space. I can, my panels are allowing me to take more people in right now. And so the One Health ID benefits to providers. The One Health ID is a centralized access to other health services such as Care Connect. And that's another key piece too, is, not having different services all over, but using the provincial attachment system via the One Health ID to bring all of that into one place, and reducing the number of credentials and passwords. So there are some passwords and credentials you need to supply to get into the PAS. Most of it is a one-time only. So that's a good news story as well on its own about reducing the number of credentials and passwords that you have to remember or keep track of. Okay, we'll go to the next one. So here's just a quick overview of the 3 key steps about getting the panel upload process completed. So that is the key step to begin with, is cleaning your panel. If you haven't done so, we hear great things about the NPPBC group, though, that people are really ahead of the work in keeping panels updated. So this may not be as big a task for this group here. The step following that is reviewing the panel upload instructions. That's going to be coming in a future communication very soon. All of your work is going to be done through a service called Dr. Bill. So you will download an extract of your panel from the EMR that you're using and upload to the secure encrypted Dr. Bill site. Dr. Bill will also be explained. So that's a third-party site that will be taking a lot of the panels from the doctors of BC and from the nurse practitioners and nurses of BC here. So those are the 3 key steps. And of course, they're going to go as smoothly as possible, right? The initial activities, as I mentioned already, is about getting some of your access. So creating that One Health ID credential. And what you need for that is a BC Services Card app and a Microsoft Authenticator app. And I'm just going to ask everybody to pop into the chat for a moment and just let us know how many people have the BC Services Card app. Now, approximately 50% of British Columbians we've heard have that app. Most British Columbians, almost everybody has the BC Services card, of course. However, not everybody has the app, but a lot of people adopted the use of the app during COVID. The second one is the Microsoft Authenticator app. How many people have already got experience with the Microsoft Authenticator app? I know myself, I use it many times a day. So I find it really handy. At first I didn't, but now I realize that more and more it requires that multi-factor authentication, and that app is really handy. I have more than one application in my Authenticator app. I have it also not just for Microsoft, but for my Adobe and many other things. So yeah, I see. Some are saying yes, some are saying no. So yeah, so hopefully this isn't going to be too big of a surprise for you. We do cover it very extensively in our training and our support materials, our user guides and such. The past activities. So once you get into this beautiful, shiny new thing, you're going to do a couple of things. So updating your clinic details. This is for directors or their delegates. So confirming the clinic hours of operations, the location of the clinic, any details around clinic staff, who's working there, endorsing clinic members for access. So, you know, including MOAs and those type of roles to be able to do updates. And the second thing is indicating if you're accepting new patients. So this is the key thing. How do we get people attached? Well, we need to know who has cycles available to take new patients. So setting your panel preferences, if you're accepting new patients, and if so, how many? And you'll know that after you've prepared your panel. Okay, so the onboarding timeline. This is the high level. We've got another one that's a little bit more granular a bit later in the presentation. So September 12th, yay, that's today. Our NNPBC COP webinar on the 20th next week. Panel uploads begin and the past training registration is available. And that whole week next week is going to be really busy. September 18th and 19th, the URL will be communicated and available to everybody. And on 20th of September, of course, it actually opens and then live training begins. December 31st is the deadline. So that's quite a ways out for the NP panel uploads to be completed. And those two chevrons on the bottom are really just about the ongoing live training that we'll be offering. And Tara's going to talk more about that shortly. And the ongoing panel cleanup and uploading starting, you know, right now and going on to the end of December at a high level. Okay. And I'm just meant to say too, you know, if you have any questions, I see people are putting things in the chat. Thank you very much for that. We will take those away. And now I'm going to turn it over to Tara, who's going to talk to you about the live training and the other training supports. Thank you.
Good afternoon, everyone. So we'll go through a couple of slides here, just outlining what the training is going to look like for the provincial attachment system. So the first one is live training. So this is dedicated time with a member of our team where we will go through the steps to get access to the PAS system as well as how to use it. So the first is the virtual instructor-led training. So this is stuff that would benefit from having an instructor present rather than reviewing a user guide. So this is, like I said, going to cover the process from start to finish. These are going to be about an hour long, hosted 3 times per day on Tuesdays, Wednesdays, and Thursdays. So 8 a.m. to 9 a.m., 12 p.m. to 1 p.m., and 5 p.m. to 6 p.m. just to work outside of clinic hours. In addition, we also have open office hours. So these are great for if you've already attended the virtual instructor training and have more questions about how the platform works. I want to be really clear that this is not necessarily a support resource. We have a dedicated support line for that. A good way of determining the difference is how do I questions are great for office hours and I cannot questions are great for support. If you don't mind going to the next slide, please. So we also have on-the-job resources that are part of this learning program. So the first one is user guides, which I briefly mentioned before. These are available within the provincial attachment system. It's actually a link right on the top of the platform. And within there are written user guides with screenshots that go through the entire platform from start to finish. We also have short videos, most of them under 2 to 3 minutes, that go through the various elements of the platform for people who are more visual learners. This is great for people who like to be self-guided, as well as you're able to pause and replay the video as you play through the platform. Next slide, please. So the course itself is broken down into 4 modules. So the first one is the past program overview. So this really goes into why are we doing this? What's this initiative for? We're also going to go at a high level through the steps that providers need to go through, nurse practitioners need to go through, all the way from creating your One Health ID through to actually accessing the system. The next module is the One Health ID registration. So this is where we talked about having the BC Services card app. So having that app is necessary in order to get your One Health ID registration, which is why we also cover that in our training. The One Health ID portal has lots of different features within it. So it's not just for the PAS system. Care Connect also connects through there as well. Our third module is the platform basics. So this is really just a high level overview of the platform itself. So this is instructions how to log on, how the system is organized, how to navigate it, what the various buttons do. We're also going to talk about the different roles and what they're able to see within the platform. So for example, directors of a clinic are going to have more permissions and more functionality within the platform than just a standard nurse practitioner or one of the MOAs within the clinic. The final module is the PAS administration, and this is primarily focused on directors and their designates. So people who can modify the facility address, things like that, and how to do those tasks as well. An important piece in the PAS administration module is how to invite other members to your clinic, like your MOAs and the other nurse practitioners that you work with. Go ahead, next slide, please.
Hey, wait, Tara, can I hop in here for 2 secs?
Of course.
Just because of the questions. I think we're still, guys, I don't want to interrupt. This is so great, but I just wanted to let everyone know. So we're talking the provincial attachment system. I think, Fiona, do you want to go back and like, I think people, I'm just getting some text and some notes, like maybe just a quick overview of like what this is going to look like, or maybe you can finish, Tara, but then in terms of like replacing attachment codes, like the goal at the end. I think we're in the weeds, and I think this is the first time most people have heard about it. Sorry, I'm not trying to be intrusive, but just lots of questions coming up.
Sure. And
is that fair?
so, yeah, and I
Okay.
don't think we have too much more slides, so I think Tara
Okay,
can
cool.
finish
Yeah, great.
explaining what the office hours and those details will be.
Okay, awesome.
Because
Okay.
we want to make sure people are aware of what's coming in the next
Perfect.
couple weeks. But I
Awesome.
will see
Okay,
all the other pieces in a moment.
great. Thanks, Tara. Sorry to interrupt.
No problem at all. Don't want anyone to feel lost while we're going through this. Thanks, Fiona, for addressing those questions after this. I think this is the last slide from me. So this just really goes through the schedule for these items. So as I mentioned previously, the virtual instructor-led training will be Tuesdays, Wednesdays, and Thursdays from 8 to 9, 12 to 1, and 5 to 6. If none of those times work for a large majority of people, then we may expand to other times as well, depending on the needs of our users. That'll be starting next Wednesday, September 20th. We also have the open office hours, so that's 8 to 9 a.m. on Mondays and Fridays. Again, this might be flexible depending on the feedback that we receive. That's going to be starting next Friday, the 22nd. We're in that session for an hour, but people can come in and drop off as questions are answered. The final tile that I just want to go through is the tier 1 operational support. So this is great for when you're trying to access and have troubles. They're available Monday to Friday from 9 a.m. to 7 p.m. You join via a Zoom link, and then they have various breakout rooms going to different support personnel who are able to answer your queries. There's also a phone line that you can call in and an email address as well, depending on your communication style. I believe this is my last slide, but do you mind going to the next one just to be sure? There we go. Thank you.
Great, and it's Fiona again, and I apologize again for not being a face, just a disembodied voice. We have time for questions, and I think I will back up just a sec, just to give some overview context for this, so that people have a little bit more of that information. So, and we actually had a slide on this, but and I'm not sure what happened. We were going to, oh, brilliant! There it is. There's a slide. Yay!
Yay.
Thank you for that. Because this helps give everybody a bit of context.
Sure.
So,
This is great.
Sure. I also put a link, Fiona, in the chat just to the news article, you know, the minister's announcement about Health Connect Registry, and it's got some really good background or information in it as well. So
Super.
folks may find that to be useful as well. If you're looking for more context and more background about how did we get here, why are we here today, that will kick it off for you for sure.
Thanks, Sarah.
Thanks very much. How long do we have for questions, Joe?
We have 15 minutes. We're good.
Okay, great. And
Yeah.
I want to just assure people that have questions and they're not answered in these 15 minutes, you can,
Yeah.
you know, send them down the chain through Joe or through
Yeah,
the, you know,
totally. Just put them in the
however.
chat or email them to us, and we have a
We will-
document prepared.
We will try to get all your questions answered. And this is the first of many sessions that you're going to hear. Many training sessions, many communications. We're just getting started. So the provincial attachment system, as Heidi set out, is essentially a plan to figure out in the real time what is the capacity in the province to attach patients and how many patients need attachment. We've been working with, you know, models that give us ideas of about how many people need primary care providers in the province, and that's not like actual real-time data. That's just, you know, models based on surveys and so on. So what this system is going to do is, in my book, revolutionize things. Like any new system, it's going to take some time to figure out a lot of details and get everybody up to speed and on board, and we're just in the very beginning steps of that. This work around the PAS before we got to now, as you can imagine, has been going on for months and months. And all along the way, I will say we have had MPs involved, and it's been very wonderful and inclusive from that angle of things. There's a few MPs who are probably online today who've been involved. I think we've had about 14 or 15 people stepping up, joining in the ongoing weekly meetings that we've been having since March. There's been a couple people attending those. And in addition to that, there's been a number of MPs who have been involved in user testing and in what we've sort of called, you know, groups where we're talking about maybe early adopters, people who were keen on this topic, and emails went out to solicit those folks and so on. So MPs have been involved all along the way. And to answer one of the questions, yes, this applies to MDs as well. It applies to whether you're on a PCN contract or you're employed or you're a fee-for-service doctor or you're a LFP doctor. However, because there are a couple of groups that actually have wording in their contract related to this system, i.e., that would be the people on this meeting, PCN contracted MPs, and LFP physicians. Those have been where we've largely focused our kind of discussions and so on. So this is the first of many info sessions that will go out, and they will go out to, you know, health authority MPs as well, but we're just starting here. If you look at that timeline, you can see that there's been these weekly NMPBC coalition meetings that have been going on. By coalition, it just coalition between the government teams working on this and folks on the NP PIP team and NMPBC writ large about how can we communicate this out and when will we do things. And we had planned, I'll just be frank, to have communication earlier. However, there's been a few things along the way that have kind of sidebarred some of that communications, but we are now ready to roll. Okay, so questions, hopefully that gives enough context, and questions in the chat. Do you want to
Yeah.
read them, Joe, or how do you
Yeah,
want
yeah,
to-
sure. Danny has a question, and then, but mainly the questions are around what we anticipated in terms of, I mean, to be blunt, I'll take Rachel's question. What do we need to do to get the bonus? But it's not a bonus, Rachel, and it's an incentive. What do we need to do to get the incentive?
Okay, yeah. Where we get our money? Okay.
Yeah.
So okay, so I'm gonna just start. Yeah, so I'm gonna back up a bit because Danny had a
Oh.
question, and one of the first things that we said you should do and you can do right now is panel management. Panel
Yeah.
management has always been in your contract as a deliverable. And you have always been supposed to engage in panel management through working with the Docs of BC PSP coaches, and that can be organized through the PIP program, and your regional league can tell you more about how to do that. You can read it online, but essentially that does not change. That's the same. You're going to do panel management to clean up your panel and shape it up so that you don't have 2,000 people who have passed away or moved away. Now we know MPs, as we said at the outset, don't have 2,000 extra people on their panel that never, that haven't been seen in 7 years. So for MPs, it's a easier task to clean up, and that's where you can start. That's number one of this. Number two is do the steps required for the PAS what do we want to call it, requirements in order to get the incentive. So panel management is one part of that. The next are the PAS steps, which were outlined there at the beginning by Heidi. The first couple steps will be, you're going to hear more about the PAS and how you get onto the platform when it is live on September 20th. You're going to need to sign up for training in order to figure out how to use it. I will say, having been involved in user testing, it is a pretty intuitive system, and I am a complete Luddite. So, I know nothing. I'm very slow. None of the youth in my life can stand looking at me typing on my phone, but I can do it. So if I can do it, you can. So it's pretty intuitive. Nonetheless, there will be training. Once you get on,
we put the link in the chat there for you, Fiona, for everybody for the register for training.
Super.
Perfect.
There's how you register for training. Great. So you're going to register for training. You're going to get onto the site on September 20th or soon thereafter, as soon as you understand how to get on. And in the site, you're going to be able to identify your clinic as being there. Now, the role of making sure your clinic is listed there falls to the director, either the clinic director, i.e. an NP director, or a medical director if it's a physician director. In some clinics, I see it says we have a clinical lead, title's not director. If that person is like a designated profession, like the clinic lead is a physician or an NP, that's fine. If they're somebody other than a physician or an NP, like a clinic manager, and you have no actual medical director or clinical director, then there might need to be a different process. But regardless of whether you find your clinic there because your director has been on board and has gotten it all up and loaded, or whether it doesn't exist there for one reason or another, there will be an alternative to that where you can there will be a place to go to call to say, hey, my clinic's not on here, I'm not listed on here, and you'll be able to get access that way. So you will hear more about that as things go on with the training. Okay, so it'll be some way to find your clinic. You find your clinic, you go, yep, that's my clinic, that's me, I'm there. And you go into the system, which again is intuitive, and you say, I have capacity to take 100 people. Or if you're past your target, I have no capacity at all. I have capacity for 500 people. However you want to do it, you know. Then what will happen is over the course, if we go back to that last slide, if you can show that last slide that had the sort of the course of the panel uploads, your panel is going to be uploaded to this system in one of in one way. I'm just gonna talk about the one way. So the one way is through this program called Dr. Bill. And Dr. Bill is not Mr. Bill from the 70s SNL skits, but it is a platform whereby information can be exported from your EMR in an uploaded and encrypted way to this site. And that's what will happen over the course of the next few months. And you can imagine with computers, the world of computers and so on, things cannot be done instantly all at once, or then the ticket sales crash and everybody can't go to the concert anymore. So what you have to do is take turns. And so there will be instruction coming about how to get it, the training on Dr. Bill and how to be able to get your panel uploaded from Dr. Bill and so on. Once your panel is uploaded from Dr. Bill, then you will have a list of patients that are your panels from your EMR of who you have as patients, and that's real-time data. The question, will we still need to do attachment codes? Yes, you will for the moment, okay? Because you can see this is something that's going to roll out over the next several months as people get all their data uploaded and the system gets fully functional, if you will. So during that period of time, yes, we will let you know when you no longer have to do attachment codes. Now, probably, what will happen is you will always have that option to do attachment codes or to do things in the PAS. Attachment codes going forward, if you submit them, will be uploaded to the PAS. But as with attachment codes, we know there's a bit of a delay. So that's not real-time data anymore. So there's downside to doing it that way. But there might be some benefits to doing that way from a logistics point of view for MPs who are onboarding a lot of people. Okay, I've said a lot. We're almost out of time.
We are out of
I
time.
think I've touched on things.
Hey, Fiona, can I high level it back to you and you correct me? And then maybe we'll just like figure out what next steps to take. Is that a good way to end, or how do you want to end this?
Yep, go for it.
Oh, okay, great. So I'm a PCN NP, and so the goal, I think what I'm hearing from you, PAS, patient attachment system, is a province-wide system where ideally every single primary care clinic and every single primary care clinician will be listed. And there will be an active way for patients to register for wait lists and be attached to clinics and providers that are accepting patients. And the logistics of that is going to be determined, but that is like the ultimate goal, while also having like real-time data. And then individually, we are going to access, we're all going to sign up for training in the next little while. We're going to get a One Health ID. We're going to confirm ourselves on the system. And then eventually over the next few months, we are going to upload our panels through that system, which we will learn about. And ideally, we will real-time manage our panels on that. We can also delegate that work. And details about that is coming, and that is all linked to our incentives. Is that like a fair elevator pitch?
That's a fabulous overview.
Okay.
And I see Danny's last question there. Danny, TBD. We are working on those details, okay? The system is, just as we mentioned, just getting up and running. And at the end of their day, yes, there will be some thing that MPs on contracts need to submit to the health authority, contracts department, to get reimbursed for their incentive, or not reimbursed, but get compensated for their incentive for meeting all the requirements that are outlined as part of this system. We are working on it. It doesn't exist yet, the system in fully functioning form, and we will let you know as soon as we can what those things
Oh, sorry. Just on that note, what we can clarify is in the current contract, you do have clinical administration hours, which are new and can be used towards QI for panel management. So you don't have to use all your QI funding for this. There are panel management hours now in your contract. So that is a difference. And if you're starting to do panel management to prepare for this transfer, you can use those, or you can do a different QI project if you're not going to use the QI funding for anything else. Right, Fee? Oh, no. I will call it by your full name. Sorry.
Yeah. So I
Yes,
mean,
that's
so yes, so this work related to panel management and this PAS, it
Yeah.
can be noted in your invoice as, panel management or PAS work
Hours.
under administrative time, and it counts up to 52 hours you can use for this. And I think there was another question I saw about delegation, and hopefully it got addressed, but yes,
Totally.
MPs can delegate to their MOA to update something, but also keep in mind that you are ultimately responsible for that information being accurate, right?
And also getting the One Health ID is going to be your access to everything eventually. So I think you want to interact with the system and know it at least. You can't delegate the whole. Yeah, totally.
Absolutely. And so just to say, this is just the first of many chats. Happy to come back. There will be more training sessions. There will be more details coming. And as questions emerge, we'll be developing, FAQs and all those kinds of things.
Yeah, and thanks, Danny, for your final question. So obviously you can't double bill. You can use the 52 hours in your contract or do a QI project, not both for the same thing. Does that make sense? Great. Okay, so again, guys, we're gonna hear a lot from the Ministry of Health. This is like a massive project. Every family doctor is going to do this too. So thank you so much, Fiona and team, for coming today. We're going to go to our breakout rooms, but I think this was a great intro.
Thank you.
And
Thank you.
we're going to do it. It's going to be great.
Great. Well, please sign up for the training. We already have 8 so far. So we're looking to fill them
Well,
up.
there's 80,
yeah.
81 people on here counting us, so we'll take us off, and then there'll be 70 odd people signed up by the time we look tomorrow.
Let's do it. That would be
Yeah,
great.
and please check the newsletter for updates and direct communication. And you can get in touch with URL about this. We're kind of in good communication, so happy to keep the questions coming as you need, guys. But we'll have more information coming.
Fabulous. Thank you.
Thanks very much, everybody.
Have a great rest of your meeting.
Yeah. Bye-bye.